Ever wonder if we could actually take the absolute best of ancient holistic therapies and somehow wire them directly into the rigorous, data-driven world of modern science? Well, welcome to this explainer on the Rajiv Gupta integrated healthcare model. Today, we're going to architect exactly how to seamlessly and safely blend conventional medical science with complementary therapies. We are diving into the exact blueprint for taking modern diagnostics and fusing them with whole person care, all without ever compromising patient safety or scientific rigor. It's an incredible model, so let's get right into it. To see how this framework functions in the real world, we're going to unpack the blueprint through 6 quick steps. We'll look at the fragmented healthcare challenge, the Gupta integrated blueprint itself, the foundation of modern medicine, synergistic adjunctive therapies, patient-centric personalized care, and finally, rigorous scientific accountability. All right, starting off with Section 1, the fragmented healthcare challenge. Basically, why do we even need a whole new model in the first place? Well, if we're being honest, we're dealing with a pretty severely fragmented system right now. On one side, you have modern medicine. Now, modern medicine is absolutely unparalleled for acute trauma, emergency care, complex surgeries, you name it. But as the data repeatedly shows us, it really struggles when it comes to complex, lifestyle-driven chronic diseases. And those currently account for nearly 3/4 of all global deaths, primarily because modern medicine traditionally targets isolated symptoms or single organs. Now, on the flip side, we have complementary and alternative medicine. This offers a really beautiful, holistic, whole-person approach. But historically speaking, it's lacked the strict, standardized clinical governance needed for absolute safety, which can sometimes lead to sketchy situations like dangerous herb-drug interactions. So we clearly need a bridge. And that brings us to Section 2, the Gupta integrated blueprint. Now, this isn't some brand new, untested therapy. It's actually a rigorous clinical governance framework designed specifically to solve that exact fragmentation we just talked about. Think of it literally like building a house. You simply cannot construct those specialized, highly personalized upper tiers of complementary care without having an unshakable, concrete foundation of modern diagnostic medicine right there at the base. Modern medicine is the base tier. Above that, you've got evidence-informed complementary therapies acting as synergistic enhancers. And then at the very top, highly targeted interventions. But here's the key. That base, it never moves. So how do we actually hold this pyramid together safely? The model relies on 8 core principles. Think of these as the vital mortar of our house, making sure we get the absolute smoothest, most evidence-informed integration possible. We've got modern medicine as the diagnostic foundation, complementary therapies as adjunctive, shared decision-making, risk stratification, personalization, continuous review, evidence hierarchy, and outcome measurement. We're going to see exactly how these guide a patient's journey step by step. Moving right into Section 3, Foundation of Modern Medicine. Let's examine those base principles that establish immediate, non-negotiable scientific trust. This brings us straight to Principle 1, which dictates that modern medicine remains the absolute primary diagnostic foundation. All diagnoses, emergency care, specialist management, that all happens here first. And Principle 2 ensures that complementary therapies are strictly adjunctive, meaning they are never ever used as replacements for essential medical treatment. This completely removes the fear of abandoning scientific rigor, right? It establishes a very safe hierarchy where we aren't just indiscriminately throwing therapies together and hoping for the best. Which leads us to Section 4, synergistic adjunctive therapies. Okay, so once that medical foundation is safely set and serious pathologies are managed, then we can introduce those synergistic enhancers to actually build long-term health. I love this concept because it beautifully illustrates how Eastern, Western, and body-based therapies are mapped in orbit around the true center of the universe here, the patient. And because we're looking at systems biology, these therapies can safely influence interconnected biological pathways. For instance, structured yoga isn't just about getting more flexible. Clinical data actually shows it can actively reduce stress hormones like cortisol and lower systemic inflammatory markers, literally compressing morbidity. It's pretty amazing. All right, Section 5, patient-centric personalized care. So how exactly does a patient experience this level of integrated care on a daily basis? Let's take a look at the human element. This experience is governed by Principles 3 and 4. Principle 3 is shared decision-making. So instead of a doctor just handing down a prescription from on high, it's a transparent collaboration. Patients can openly discuss things like herbal supplements without any fear of judgment, which goes a long way in preventing unsafe interactions. Then we have Principle 4, rigorous risk stratification. This ensures that, say, a highly vulnerable patient with an unstable condition gets priority conventional management first. It perfectly matches the intervention to the clinical need, prioritizing safety above literally everything else. Now, let's look at Principle 5, which builds on this with personalization. We're going way beyond just generic symptom treatment here. True personalization looks at your unique genomics, your lifestyle, your sleep quality, even your environmental exposures. It fully recognizes that, thanks to epigenetics, two people with the exact same genetic risk profile can end up with vastly different health outcomes just based on their daily behaviors. And this is where the model gets incredibly futuristic. By leveraging artificial intelligence and wearable tech, the Gupta model shifts medicine from being strictly reactive to highly proactive. Instead of relying on episodic hospital checkups, where we essentially just wait around for a disease to happen, we use continuous physiological monitoring. So AI tracks your digital biomarkers. Maybe it's a drop in physical activity, slight sleep disturbances, or early metabolic changes, and it identifies chronic decline way before it becomes an acute emergency. This is what we call anticipatory medicine, and it is a total game changer. Finally, Section 6, rigorous scientific accountability. The big question here is, if we're personalizing all this care and utilizing such diverse therapies, how on earth does the system maintain accountability and keep improving? Well, that is exactly what Principles 6 and 7 are for. They act as the scientific engine of the entire model. Principle 6 is continuous clinical review. This prevents rigid adherences to ineffective treatments. Look, if a therapy just isn't working, we adapt or we deprescribe. Then we have Principle 7, the evidence hierarchy. This demands strict scientific integrity. Every single therapy, whether it's a cutting-edge pharmaceutical drug or an ancient Ayurvedic botanical, has to prove its clinical worth and its safety. Absolutely nothing gets a free pass just because it's quote-unquote traditional. And this setup creates a really elegant, continuous accountability loop, which brings us to our final core principle, Principle 8, objective outcome measurement. Basically, we apply the evidence hierarchy. We deploy the intervention safely. We measure the objective outcomes, and then we feed that data right back into the system. This transforms the integrated model into a continuously learning healthcare system that's constantly refining its pathways based on hard, real-world data, not just anecdotes. I think Professor Gupta's defining quote captures this entire philosophy perfectly. The purpose of integrated healthcare is not to replace modern medicine. Its purpose is to deliver the safest, most effective, most personalized, and most compassionate healthcare. Integration isn't about replacing science. It's about systematically delivering the absolute best care possible by using top-tier, evidence-based interventions from all appropriate disciplines. So we've explored exactly how the Gupta integrated healthcare model uses a rock-solid foundation of modern diagnostics, layers it with evidence-informed adjunctive therapies, and drives it all forward with continuous AI monitoring and strict scientific accountability. With this structured blueprint for precision longevity now fully unpacked, the most important takeaway for you to consider today is this. With the tools of anticipatory medicine and personalized care finally at our fingertips, how will you actively influence your biological destiny?